Any ideas what the most expensive medical condition in this country is? It's not heart disease, nor obesity or diabetes. It's mental disorders by far. So we're talking more than $200 billion in 2013, and nearly 40% spent in institutions like jails.
Yeah, in our continuing series, Be Mindful, we visit the largest psychiatric facility in the state of Texas, and we didn't have to go far at all. Inside the well-secured Harris County Jail.
This is the general population cell block 2H2. We have approximately 10,000 inmates in detentions.
That is the size of a small city. Only in this town, nearly half the residents have a diagnosed psychiatric disorder. The mental health ward has its own nurses' stations and 7 full-time psychiatrists. The most seriously ill dorm separately, but not quietly. The jail has just under 400 mental health beds. A little over 100 of them are for acute patients, which is right here in this facility. That doesn't include the 2,400 inmates today that are on psychotropic medications in general population.
On any given day, there's more people on psychiatric medication in our jail than in all 10 state hospitals.
Major Mike Lee heads the mental health unit. Last year, the jail spent $22 million tax dollars on psychiatric services. Most inmates with mental illnesses are charged with minor crimes, trespassing, theft, disorderly conduct. Many only get medication or therapy behind bars, which stops when they are released, and then they reoffend. You have frequent flyers here, people who really come through the system a lot.
20, 30, 40, 70, 80 times for these types of offenses. They're very sick.
In response to the growing problem, Houston and Harris County have 19 search or crisis intervention response teams.
I believe the only unit that we have in the country that allows a police officer and a therapist to ride on the same car.
Both are required to have extensive training, like Deputy Jose Gomez and licensed clinician Mike Hawkins. They've been partners for the last year.
Possibly a paranoid male calling in, got shot, he's just rambling.
On scene, CERT members work to evaluate, de-escalate, and if appropriate, keep a suspect out of jail.
So you're saying that you feel like if you don't get treated that you're going to be walking around with weapons?
The clinicians have access to county mental health records, and it turns out they have extensive information on today's suspect.
Previous medications, how many times they've been in the hospital, like for example, maybe they're hostile towards police.
It's like making a house call.
Exactly, and at a very critical time when somebody's in great distress.
Last year, local law enforcement took 6,500 people to the Harris Center, a short-term county psychiatric facility. They went there instead of jail.
Our mission is to put bad people in jail and to keep the public safe and not to be a psychiatric facility.
A lot of work there. Joining us now is Harris County Judge Ed Emmett. You are truly passionate about this issue, mental health. So let's start, I guess, with the big question right now. Everyone has been talking about these mass shootings involving, individuals who've had documented mental illness, mental health problems. And I know, there's been a lot of discussion about that. Anything that would make sense to address an issue like that?
For far too long, all over the country, but particularly in Texas, we've treated mental health as somehow different from other health, and it's really not. The brain's an organ, and we need to focus on the health care of people with mental issues, rather than just sort of saying, well, we're going to push them to the side. Years ago, the state of Texas closed a lot of the big mental health facilities, and that was a good thing, put them back in the community. But unfortunately, if you don't have the financial wherewithal to take care of a family member, too many people end up homeless. They end up, as we just saw, frequent flyers through the criminal justice system.
One of the things that I know you all are working on over at the jail is this, the jail diversion desk, and then of course the homeless population continues to be an issue. What's that impact for Harris County and for the city?
Well, it's a huge impact. Number one, it costs a lot more to deal with someone in a criminal justice setting than it does in a mental health setting. But then the whole homeless population, the impact on them and their families, and then on society in general. We just have to focus on mental health and make that a priority going forward.
Talk about the jail diversion program, the desk there. That's a real positive. We all complain about what's not done.
But the legislature 3 sessions ago allowed a pilot program for us to identify these people who keep getting rearrested and divert them, as you heard Mike Lee talking about. That project's worked very well. Unfortunately, we can only do several hundred a year, and we have thousands that we need to do that. So it's a matter of putting resources behind now that program.
There is an expansion coming to the psychiatric hospital.
We are expanding, roughly doubling the size from about 225 to 450, but we have 4.7 million people who live in Harris County.
So something, but not yet enough.
We are making progress,
All
but not fast enough.
So, you know, you talked a little bit about that, the deinstitutionalization that put a lot of folks into a situation when they're on the street, going through the jail. I mean, is there any talk about, you know, bringing institutions back online?
No, not the old style institutions. I don't think anybody would want those. But we do need sort of step down facilities where, you know, I've now worked with 4 sheriffs and they've all complained that, you know, people get clean while they're in jail and then they're put back out and they get off their meds and things go bad. That's why the Harris Center and private institutions, private facilities, we need every resource we can to focus so that we keep these people out of the criminal justice system.
All right. Harris County Judge Ed Emmett, thank you very much. I know you are a busy man. Thank you for stopping by to talk to us about an important issue.